Hi, good morning. So I'm gonna perform an auto scenario. So I just received a call from the nurse station that the doctor would like a patient to be hooked up with an oxygen. So before you always go inside to the patient's room, make sure you check the patient's chart so that you're able to get any pertinent information, and also to make sure that you're able to get the exact order from the doctor. So what I got a call was just a patient to be hooked up with nasal cannula at 3 liters per minute. So I have here nasal cannula, and when you go inside to the patient's room, make sure you introduce yourself to the patient, explain what the therapy, its purpose is, and also if there are relatives present, make sure they're able to understand them. And then make sure you wash your hands at all times, and then you always do obtain vital signs of the patient, assess them, and then once you're done, you're gonna hook this one to the patient. So first is we always hook this one, turn off the flow meter, and then before putting this to the patient, make sure you feel it with your fingers if there's air coming out from the nasal prongs, and then make sure the device there's no any kink or obstruction. So when putting this one up, make sure you loosen this. Make sure you're able to let the patient be comfortable. And then make sure you tighten it, and then you should always make sure ask the patient if is it too tight for them. Then once you're done, make sure you always do a post assessment to the patient. Ask them if they are comfortable or not, and then if everything goes well, I'm gonna go out. And then I just received a call right now that the patient complained any dyspnea, and then when I was inside, I observed the patient to be mouth breathing. So I recommended it to the physician to be hooked up with a Venturi mask. It could have been better to hook up with a simple mask, but I just recommended with a Venturi mask because with a simple mask it would lead to rebreathing of carbon dioxide. So I'll just have to prefer with a Venturi mask. So with the Venturi mask, it is giving precise FiO2, and because the flow given here was about 3 liters, so I recommend giving it about 31%. So regardless of the flow meter, still the patient would able to receive 31% oxygen. So I'm gonna turn this one off. Then of course, before putting this one, make sure this one is being loosened, and then always tell the patient that this device is kind of noisy. So but still we will tell the patient that this will benefit them because they're having experiencing any dyspnea. Then I observed that the patient was having mouth breathing. So first is make sure you feel it if there's air coming out, and then make sure you're able to set the flow in here 31% before putting to the patient. So once, make sure you put it in here, make sure that the connectors are not kinked, and then every time you put this one, you can either tighten a little bit, and then make sure this one is able to make a seal, and then every time after putting this one, make sure you always do your assessment to the patient, obtain the vital signs, and then once everything is okay, we notice that the patient was doing well already, we will always chart it outside, communicate with the physician if they're present, or with the nurse.